I'm Rachel Denlinger-Apte. I'm an assistant professor in social sciences and health policy at Wake Forest University School of Medicine, and I work within the Division of Public Health Sciences. We're in Bailey Park right now, which is formerly part of the R.J. Reynolds tobacco manufacturing plant in downtown Winston-Salem. And so it's really hard to talk about the history of Winston-Salem without talking about Reynolds Tobacco. It was probably the single largest employer in the city. So they provided economic opportunities and healthcare opportunities in the city. And a lot of people living outside of the city also participated in tobacco growing as well as the manufacturing component. And so it's really been an economic lifeline in the better part of the 20th century. The Surgeon General released its first report on tobacco in 1964, and at that time, more than 40% of adults smoked cigarettes in our country. So today we know about 12% of adults are smoking cigarettes, which is a huge decline, and a lot of that is attributed to major public health campaigns to raise awareness about the real health harms of using combusted tobacco. So lung cancer, emphysema, chronic bronchitis, any type of cardiovascular disease, many other types of cancer, breast cancer, bladder cancer. And so the health harms are just very real and very significant. They estimate about 480,000 people die each year in the U.S. from some tobacco-related disease. We know that most smokers want to quit. So when we ask in our survey among the people that reported current cigarette use, are you interested in quitting smoking in the next 6 months? And almost 2/3 of people said yes. So there's a big desire to quit. And so what we need to do is identify opportunities and resources available to our tribal communities to help bridge the gap between current smoking and successful quitting. Because it's a challenge for many people. And providing access like nicotine replacement therapy can be really helpful for people who are trying to quit smoking. So my research and expertise and where I started from was looking at federal regulation of tobacco. So in 2009, the FDA gained regulatory authority over tobacco products. So similar to how they regulate drugs, medical devices, cosmetics, and food, which surprisingly, until 2009, there really was no oversight for tobacco products. So industries could really sell the deadliest commercial tobacco product with minimal restrictions other than taxation. And so that was a huge landmark achievement for us and for public health to be able to regulate commercial tobacco products. Right now, one policy that's under consideration by the U.S. Food and Drug Administration is reducing the allowable nicotine content in cigarettes so that all cigarettes would have very, very low levels of nicotine, making them essentially minimally addictive or non-addictive, giving people who smoke really back the freedom to smoke on their own terms. So nicotine is a highly addictive chemical, and it's what gets kids hooked on cigarettes, and it's what keeps people smoking. When 60 or 70% of people who smoke say they want to quit, nicotine's really the reason why they're unsuccessful. And so a policy that reduced the amount of nicotine in cigarettes, making them less addictive, could really help people break their addiction to cigarettes, and that they can smoke when they want to and they can quit when they're able to, and really could prevent kids from picking up the habit. It is intentionally altered to make it more addictive. So there is evidence from commercial tobacco industry documents that the commercial tobacco industry has been manipulating nicotine content for decades to keep their products more addictive and more appealing. And so from our perspective, from a public health viewpoint, reducing that nicotine level really gives the control back to the consumer so that they have the option to smoke when they want and the option to quit successfully when they're ready. And right now that option isn't available to them because their products are so highly addictive and manipulated by the industry. Cigarette smoking is the leading cause of premature death and disease in our country and contributes to about 480,000 premature deaths each year. So according to the 2020 National Health Interview Survey, about 27% of American Indian adults in the U.S. reported cigarette smoking. We found in our first wave of our commercial tobacco survey in North Carolina that about 23% of our survey respondents reported smoking cigarettes every day or some days. So very consistent with what we're seeing at the national level. Our survey is a convenient sample, so we invited people primarily at community events like powwows, Lumbee Homecoming, different health fairs. So it's not necessarily a fully representative sample of all tribal members in North Carolina, but it really gives us a good estimate of how much commercial tobacco use is happening within our state among tribal communities. So the overall U.S. adult smoking prevalence is about 12% of the population, which is substantially lower than it was about 60 years ago when it was about 40% of the adult population. However, that still equates to about 28 million adults in our country smoking cigarettes every day or some days. Here in North Carolina, among tribal communities, we saw about 23% of adults reported smoking cigarettes every day or some days. So again, much higher than the national prevalence. One of the things that we've tried to do with our commercial tobacco survey is really understand the impact across different tribes in North and South Carolina. The large national surveys often do include some tribal people, but it's across the whole country. They never ask questions about tribal affiliation, and oftentimes the sample sizes are very, very small. And when you have really small sample sizes, you really can't give a very good estimate of the population level impact of smoking. So that's why we took a step back and decided we wanted to understand tobacco use in our state among tribal communities. And so what we found with our first wave of our tobacco survey is about 23% of adults reported smoking cigarettes every day or some days. About 10% reported using cigars or other combusted tobacco products every day or some days. And both of those are substantially higher than the national prevalence, which is about 12% for cigarettes and maybe 3% for cigars. So we have a real need in this state to reduce combusted tobacco for our American Indian populations.